think we've learned over the past 2 years? That there are health disparities in the US? That there are deep-seated biases and racist sentiments in our society? As a Latina from the Bronx, I didn't need a pandemic to tell me this. As a matter of fact, Black and Hispanic Americans are 3 times as likely to contract and 2 times as likely to die from COVID-19. Healthcare equity is an imperative, and it requires leaders to be intentional and deliberate about the ecosystem in which the healthcare system resides and in the training that staff at all levels should be receiving. Did you know that Black women are 3 to 4 times more likely than white women to die of pregnancy-related causes? Did you know that in the US, minority patients are less likely to be prescribed medication than their white counterparts? Did you know that in the US, minority patients are less likely to receive pain medication than white patients? Studies are finding that some of these challenges are tied to implicit bias. These biases exist in everyday interactions between patients and administrators and hospital medical staff on a regular basis. Achieving health equity in the healthcare system is really going to take a lot more than small changes and targeted interventions. Achieving health equity is going to take large-scale strategic planning. It's going to take changes in how staff are onboarded, how doctors are trained, and really the entire ecosystem of a hospital system will need to understand that changes need to be made for healthcare equity to even begin to be implemented. I can provide you with cultural competency and implicit bias training for all of your staff at all levels. I can also help by consulting and coaching administrators in ways to find synergy and collaboration with vendors and staff, and also with other leaders and donors. I recently had an experience at a medical facility when taking my mother on her appointment. Our appointment was at 12:30. We arrived at 12:25. The doctor did not see us until 1:48 p.m. It took all I had to keep my mother from leaving, and I finally got her to agree that if we had not seen the doctor by 2 o'clock, that we would leave. In that moment, the doctor did arrive, but she only spent 15 minutes with my mother. The waiting room was full of Black and Latino patients who had been waiting just as long, if not longer. And they were all over 60 years old. It just signals to the patients in that facility that their time is not valuable. And if they're anything like my mother and wanted to leave, and maybe even perhaps did leave, they did not receive the health care that they deserved and that they needed, because they were made to wait well over an hour after their scheduled appointment. These are the kinds of things that need to be addressed, as minor as it may seem. If you're a leader in the healthcare system, check out RosannSantos.com or give me a call so we can discuss ways that your organization can be more intentional around issues of diversity, equity, and inclusion. And remember, se habla español. My name is Rosann Santos, and I look forward to working with you.